physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together, we're one of the most famous physical therapists on the internet.
In our opinion, of course,
How
Bob.
can I say that with a serious face? Today, we're going to talk about the 6 big lies about knee pain, knee arthritis, and knee surgery.
That's a pretty strong accusation. Six
All
big
right,
lies. Let's
get
find
right
out.
into it. Let's get right into it. Knee pain can occur at any age. You can have, sports injuries and falls, but as we age, pain begins to emerge for a lot of people. I saw one statistics where it was 10% of people aged 40 to 50.
Okay.
And then by the time you're 70, it's 25%. And I actually think that's low. Because the amount of people I know with knee pain in my age group, which is the 60, is really quite high.
Well, a lot of people just don't talk about it.
That's true. They don't go in to a doctor.
Right.
And that's my friends. Right. They go to me. All right. So the typical scenario that we see is, you're going to have a 50-year-old or a 70-year-old. They start to have some knee pain. They go in to see their doctor, and it's not going away. So the doctor orders some type of imaging test.
Sure.
Maybe a knee x-ray or maybe eventually an MRI.
Right.
And they're going to find something. I'm going to tell you right now, they will find something because all of our knees are starting to wear out. There's that wear and tear, and the patient thinks that wear and tear might be causing their pain. It might be. There's a good chance it may not be.
Sure.
What we have found is that they have done many, many studies on this, and it's kind of the popular topic right now, Brad, is that they'll do imaging tests on a non-painful knee and a painful knee, and they'll look, sometimes the painful knee will look better than the non-painful knee.
I've had a number of patients come in, they say, this knee hurts, but on the x-rays, this one looks worse.
Yes.
And so it's like, which knee do you get replaced?
Right. So we tend to go by pain levels, and also, in addition to that, we try to do things that reduce the pain. But we don't assume that just because you're bone on bone, you're going to have pain or it won't get better. It may get better. So let's
or at least you can curb it from getting worse, hopefully. And it all depends. Everyone's a little different.
Yeah, so we're going to look at daily habits and stressors that are happening to your knee, and we're going to see if that improves when we change those.
Sure.
So, all right, next myth that we hear is my knee arthritis is going to continue to degenerate, and my pain's going to get worse. Because, I have arthritis. It's not going to get any better, right?
Sure, right, Bob.
Not necessarily true.
Right.
So they've done several studies that your pain may remain the same, or it may even get a little bit better. So my wife is a good example of this. About 3 years ago, she had severe episode of knee pain to the point where we had her on crutches. We were all worried because we were going on a trip to Seattle, and we thought, oh my God, she won't be able to do anything. She will have to sit in the car while I go hike. So, but we got it flared up her knee. To this day now, she's back running. She has no knee pain. So
what did she do, or are we going to talk about that later?
We're going to talk about that in other knee videos.
Oh, yeah, okay.
The myth is, that
right, yeah.
You're not doomed to a life of knee pain just because you have a flare-up.
Right.
So, all right. A lot of patients I hear, Brad, say this. I wore out my knee because I did a lot of milking, or I did a lot of running, or I did a lot of hiking. I'm milking a cow.
Farmers.
Farmers. I did a lot of roofing, and they feel like I did this to my knee, and it's not gonna. I'm doomed again to have knee pain.
Sure.
And that's could be the furthest from the truth, because we found that active people tend to have better knees than sedentary people. So
sure.
Don't believe that just because you had an active lifestyle that you're going to have knee pain and that you can't get rid of it.
Sure.
So, number 4, I don't want to make my arthritis worse, so I'm going to rest my knee.
Ah, yes.
I got a lot of elderly people that have said that, and I think they just didn't want to work. I've been working my whole life. I don't want to work now.
Which, you got to respect that to a certain degree.
Right.
But, if you keep a joint idle, a painful arthritic joint, it needs movement. Doesn't mean you're going to go out and lift weights or crawl around on your hands and knees for movement. You have to do appropriate movement.
Right. Movement that's under control and that, that doesn't increase your pain. Joints love movement. It actually increases your synovial fluid, which is
Sure.
kind of the oil of the knee.
Mm-hmm.
So the only thing that Brad and I would say, I think, is that knee pain or knee arthritis can get so advanced that even movement is bad for it.
Right.
I've seen
yeah.
some knees like that where it's, creaks creaks like crazy.
Yeah,
and,
you can literally hear it
Yeah.
and feel it. That's beyond
yeah.
hope.
And that doesn't happen very often.
Sure.
Happened to my grandpa because he let his knees go and he never would have surgery on them and they got to the point where they were pretty much fused almost by
Sure.
themselves. All right. Another lie we hear. It's not really a lie, just a statement. My mom had arthritis, and she suffered from it for years, so I'm going to get arthritis.
Right.
And arthritis is inherent in some situations, but it also is very common. So,
Sure.
if your mom had arthritis, welcome to the club. I mean, if you live long enough, I think you're going to get some form of arthritis.
Right.
So, it's amazing how the body can adapt to getting better if you allow it to heal.
Right. So treating it properly, and that's what we do have on the other videos in this series that are specific to
Right.
how to treat and how to exercise a sore arthritic knee.
Yeah, I'm sorry we're not giving any answers here today, but we're just going over the things that people commonly say to us that are not true. And you have to start off with the proper mindset, I think, if you're going to be, get a positive result. You got to believe it could happen,
Right. Yep.
So, the last one I hear a lot is I'm going to eventually need a knee replacement. I might as well do it now. Well, there's a lot of things to say about that. That may be true, especially
Right.
your knee pain is really bad and your health is a question mark.
Right.
But if you can put it off and tolerate or get the knee better, why have the knee replacement now? They last maybe, 20 years?
That's typically what the rule
Yeah.
of thumb that most surgeons say.
So if you're in your 40s or 50s, you could outlive that knee replacement by pretty easy.
And putting a second one in
Right.
is
It's
more
not
difficult.
fun
Yeah.
at a
Those
later age.
revisions are not desirable.
Right.
But surgeons will typically they'll tell you that maybe we should wait if you can get 5 more years out of it. Plus technology always improves.
Yeah.
Yeah.
Exactly. Who knows what they're going to come up with by, bionic type knees that will be better than
Well,
the
now I
regular
think they're working on custom prosthesis.
Oh, are they really?
Versus,
That fit the person.
right.
Wow,
Right.
nice.
Yeah.
All right, so speak to your doctor about it, but you really want to trial a physical therapy before you do do knee surgery. So, all right, that's the 6. You want to check out the rest of the program on knee. We have it at bobandbrad.com.
Oh,
Go to the
that's
program
right.
section. We got a whole bunch of videos on how to treat knee pain. What else we have with it?
Well, Bob, we have an outstanding PDF, which is very
Right.
nice. Print it off. It'll show you everything we talked about here for this, as well as all the rest of the videos, exercises included. There is absolutely no cost to this. It's absolutely free. We don't even ask for an email. It's just a
No
gift.
catch.
That's
No catch
right.
to it.
Absolutely.
All right.
Be careful.
Thanks for watching.